Hello, everyone. I'm excited to be here. I'm Laura Burt. I'm the Business Development Director for ViewPoint Center, and we are doing a COVID version of Whiteboard Wisdom. And we have Jordan Rigby, our Assessment Director here, as well as Jennifer Young, who is our Psychiatric Nurse Practitioner at ViewPoint Center. And I'm going to turn the time over to them.
All right. Hi, everyone. Welcome to our very special pandemic whiteboard session. We're going to do our best to maintain social distance and stay safe. So we're doing this one a little bit differently than we've done in the past, where we're going to do it all through a video conference. And so thanks for joining us today. My name is Dr. Jordan Rigby. I'm the Assessment Director at ViewPoint Center. Today, we wanted to talk about a very special topic that is having an impact on so many people, not just adults, but also adolescents. Today, it seems like more than ever. We're going to talk about adolescent depression. This is something that traditionally we see as, feeling sad, feeling down, hopeless, and that's what it is for most of us. However, in adolescents and in adults, it may look a little different. And so that can be really tough as a parent to feel like you're getting tuned into your child's feelings. It's hard to get tuned into your child's feelings. And so I wanted to take a couple of different things and talk about them today, and what we can do to manage them. First thing regarding adolescent depression and how it's different in adolescents and adults is socially. Typically in adults, adults may isolate completely from all family and peer relationships. In adolescents, they may continue to associate with their close friends. They may be selective of who they associate with, but they'll associate with their close friends, or they may just change their peer group entirely. Also, sleep's a little bit different. In adults, somebody that struggles with depression may experience what's called hypersomnia or insomnia, where they sleep too much or too little. In adolescents, they'll still find time to sleep. It just might be at odd hours. The next one is emotions. This is a big one because depressive feelings, what we view them as is sadness, lack of interest in pleasurable activities, and feelings of depression. That's true for adolescents. That doesn't change. But these are new feelings for them. They don't have the experience to kind of define and understand them like many adults do. And so those feelings are going to come out, and they often come out as irritability and anger. Adolescents may be sensitive to criticism. And then that really kind of relates to the physical side of things as well. Like I said, these feelings are going to come out as adolescents experience them, and they may come out physically as headaches, stomach aches, pains, or they may just not understand them, and so they just don't feel well. And so there's a lot of different things that we can look at here at ViewPoint Center to get a better idea of how a specific adolescent experiences their specific form of depression, because it's different for everybody. And one of the ways is really get to know them. And part of that is treatment. Part of that is treating the adolescent. And so I've invited Jennifer Young. She's a member of our multidisciplinary team here at ViewPoint Center. Her role is a psychiatric nurse practitioner working with medication management. I've asked her to talk a little bit about some of the ways that we treat depression. And so we're going to share her screen and get to talk about some of that treatment.
Okay. Hi. So while we're waiting for this to switch over, so we are going to explore treatment avenues for depression. There are several ways to address your child's depression. It starts with recognizing there is a problem. Jordan explained how depression can present in unexpected ways, making it easy to miss. This is especially true in adolescence. There are numerous interventions. Which one is right for your child? Okay, so therapy. At ViewPoint Center, we use a multifaceted approach. As you can see, there are several therapies to choose from. At ViewPoint, we use interpersonal psychotherapy, cognitive behavioral therapy, dialectic behavioral therapy, social skills groups, group therapy, and experiential therapies, which include recreational, guided imagery, and music. There are several others, including animal care, such as equine therapy, arts and crafts, role-playing, or acting. And, so those are the therapies, can be one of the first approaches that parents might take. The next is really ensuring lifestyle changes. We want to encourage healthy lifestyles with an emphasis on avoiding substance use. It's not uncommon for adolescents especially to experiment with substance use, and this is one of the ways that they use to self-medicate. So we want to avoid those kinds of things which are risky and actually make depression worse. Getting plenty of physical activity is really important, as well as maintaining a healthy diet and getting adequate sleep. And then if the therapies and the lifestyle changes alone are not effectively treating the depression, then, medications might be the next step. Each child varies in their response and ability to tolerate a specific medication and dosage. And so it could be a trial and error with children especially. And but that is an option if the others are not really improving the depression. Next is alternative remedies. These can include like over-the-counter supplements such as St. John wort or SAMe, light therapy, meditation, which is another focus at ViewPoint Center, along with relaxation techniques. We really feel that meditation and being mindful and trying to stay in the moment can be very beneficial for depression. There's also acupuncture, which is used as an alternative. Other methods can include the following more intensive interventions. If your child's depression is persistent and severe, including suicidal ideation, self-harm, and challenges in overall functioning, it is not uncommon for parents to seek higher levels of care for their child. There are more invasive approaches when other modalities of treatment have not been enough to effectively treat the depressive symptoms. This can include ECT, which can be considered a gold standard for treatment refractory depression. And so there are a lot of options, and it is treatable. And I'll turn the time back over to Jordan.
Thanks, Jen. So this is a tough topic for a lot of different parents right now, given kind of what the whole world is going through. We've seen an increase in a lot of these depressive symptoms. So we just wanted to send something out to make sure people were aware of the differences between adolescents and adults in depression and some of the treatment options that might be available. And so if you have any questions, as always, feel free to give us a call at ViewPoint Center. We're happy to help out any way we can. Thanks, everyone.
Thank you.